Next is Ray Marshall. Welcome. Thank you for being with us all day. Waiting for this moment, and many others are here too. So,
Thank you all. Dear co-chairs, Senator Anwar and Rep. McCarthy-Vahey, and esteemed members of the Public Health Committee, thank you for your patience. It's an honor to be with you today. My name's Ray Marshall, and I live in New Haven. As a graduate student at the Yale Schools of Public Health and Management, I research community health centers as crucial entry points to healthcare for underserved populations. Thank you for the opportunity to provide the final testimony in support of HB6873, which strengthens the oversight and regulation of healthcare transactions in Connecticut. At the heart of this bill lies a fundamental question. Why should Connecticut families pay more for healthcare without actually getting better quality care, especially as looming federal funding cuts threaten healthcare affordability? Today, I will explain why this bill must not only be passed but strengthened with an amendment to help the state fully realize the oversight and investment measures as written. Healthcare acquisitions require rigorous evidence to assess their impact on cost and access, and so I propose increasing funding for the AG and OHS to strengthen oversight and enforcement efforts. Before reading my previously prepared testimony, I'd like to address a previous claim from cga that private equity purchases are less harmful than hospital acquisitions. So the Avalier study reference notes a marginal drop in Medicare costs, but fails to account for how these purchases raise or impact costs for the privately insured. What we know is that Medicare has fixed costs, right? Which means that the only thing that affects Medicare costs for a system is the quantity of services provided. Healthcare costs for the privately insured, on the other hand, are negotiated between hospitals and insurers, meaning that private equity acquisitions often increase costs for the privately insured by driving up provider negotiating leverage, which the study completely omits. This legislation is arguably more important in Connecticut than it would be in most US states due to this state's high merger rates, which are driving up healthcare costs fast and severely limiting competition in our healthcare market. I'd like to highlight some concerning statistics about our state. So together, YNNH and Hartford Healthcare bring in 3/5 of all Connecticut health system operating revenue annually. Additionally, YNNH currently controls 83% of hospital care in over 10 towns along the Connecticut shoreline. In 2019, health economists in Connecticut found that concentrated hospital markets drive up prices more than 20% for services. These numbers clarify the need for decisive action to strengthen oversight and keep healthcare prices in check. Connecticut families and businesses simply cannot afford to absorb these rising costs. Part of the reason why mergers continue to increase is that both the FTC and the Connecticut AG's office have inadequate resources to oversee and enforce antitrust laws on every deal, as noted by Attorney Demers earlier today. To put this in perspective, a 2024 study assessing over 1,000 hospital mergers between 2002 and 2020 found that while 20% of these mergers reduced competition, only 1.1% of them were challenged by the FTC. This gap—
Excuse me, Ms. Marshall, but you've reached your 3 minutes.
Okay,
Thank you.
actually, I really want to hear this statistic. But can you go back a little bit and then start about the two hospitals here and repeat
Sure, yes, of course. So the Connecticut hospital marketplace is essentially a duopoly, meaning that there are two primary healthcare systems in the state that dominate the hospital market here. Those hospital systems are Yale New Haven Health and Hartford Healthcare, which collectively bring in over 60% of the healthcare operating revenue annually in the state.
Wow, keep going.
Yeah, again, YNNH currently controls over 80% of hospital care in over 10 towns in Connecticut, and I have more of these similar statistics in my written testimony as well that you can reference, and I'd also be open to talking more about it after. Like I said, one of the primary reasons why these mergers continue to occur, both in the private equity space and in the hospital acquisition space, is because there aren't adequate oversight and enforcement efforts because of the lack of resources. So this gap on a federal level leaves states to step up and regulate on their own, which the governor is trying to do with this bill, but it's also why the proposed amendment to increase oversight funding is really crucial. So we heard from Attorney Demers that the AG's office doesn't have adequate funding or staff to implement this bill at scale, and that was the first testimony we heard today. So without this amendment, regulators won't have the resources to thoroughly review mergers or prevent hospitals from exploiting loopholes, right, which we know that they're good at, and costs will continue to skyrocket for patients. I have additional material on how this is impacting Connecticut's economy currently and how it will continue to, but I can talk about that at a later time as well.
So this is very helpful. Do you have a written testimony?
I do.
Did you upload it?
Yeah, it's up there.
Okay, sorry.
No
I didn't
worries.
check it yet. All right, this is very helpful. I wanted to thank you for this. I do know that Representative Kristen McCarthy has a question too, but I wanted to ask you one more question.
Yes.
This pattern for the outpatient part, how would you look at that? Because there are two different situations. One is the inpatient and the hospital mergers and so on. We recognize that. But in the outpatient setting, you probably heard throughout the day there are a number of physicians who came in and they say, well, we need somebody to manage the practice. We don't want to manage it ourselves. Can you understand if that model is an option?
Absolutely, yeah. In all transparency, my research is mostly on large hospital mergers, and so I can't speak to small independent firms that much. I do know that for independent firms, the payment structures for Medicaid, Medicare, and privately insured individuals is very, very different. And so even though technically potentially a private equity purchase of a small firm might lower the quantity of care provided for Medicare patients, meaning that costs are saved for Medicare patients, it might also drive up those same costs for the privately insured. But I can't speak to the entirety of the question.
Thank you so much. Representative Kristen McCarthy.
Thank you very much, Mr. Chair, and thank you for being here with us and for waiting through the day.
Thank you.
In terms of, first of all, thank you. Your testimony is online, and I appreciate the references that you have here so that we can take a look at some of the sources that you have used in your research. Just to the conversations earlier, the consolidation conversations, and you were referencing your testimony, and some have said that the bill just basically it paints a broad brush, or it impacts everyone equally, where what the stated goal is in many respects is to get more insight into specifically the private equity firms. Again, not about greed, just about a different model. It's about a business model versus a patient care model first. Which one has primacy? So can you speak to that, that difference between those consolidations, whether it's a nonprofit and the for-profit?
Can I clarify the question?
Sure.
Okay,
It's
so
a little convoluted, so you certainly can.
No worries. What I'm hearing is you're wondering what the difference is between a merger, a hospital merger, and a private equity merger.
Thank you for trying to clarify this. What we heard during the day today in testimony from a number of people is that the consolidation is the broader concern. That's the bigger issue.
Yes.
And you spoke to the significance of that in your testimony. The bill is seeking to get at the private equity piece of this conversation. And so we've had some conversation here, as Senator Anwar said, looking to improve or nuance the bill to be able to more directly get at that issue. And just wondering if you have some specific thoughts about that.
Absolutely, and I'd be happy to discuss this further later when I've had an opportunity to do a little bit more research, but I will say that in private equity, we've heard a lot about the loopholes that are identified that can really be used to seed whatever kind of regulations are currently in place. And so thorough enforcement and oversight funding is really needed on these deals to ensure that there is adequate implementation of the law, right? We know the law as written and not enforced is not useful to us, and so we need to make sure that this bill is resourced enough in order to implement effectively.
Thank you for that, and you may have an opportunity to testify in appropriations related to the governor's budget request to add additional resources. Thank you, Mr. Chair.
Thank you. Seeing no other questions or comments, we want to thank you, and then thanks for being here. I'll probably follow up for some research at some point. Thank you.
Thank you so much.
Next is Lisa Duchesne. Welcome.